Hey, what are we doing today? First of all, we have another campus tour from somewhere, some Baptist school. We had one a couple of weeks ago, but it was that one was on exam day, and most of you had taken the exam, turned it in, and were taking a break when they came. So you weren't even here for that. But they're going to show up here. Supposed to be about 10:35. A group of less than 10 students. I don't know if they're high school or middle school. Mostly they want to see our new toy over there. So we're supposed to finish up chapter 5 today and then start on skeletons. Chapters 6, 7, and 8 are on the skeletal system. So when those people show up, you guys can, and you can, if you want to get involved with the campus tour with these kids, that's fine. Talk to them, or it's going to be pretty informal. Or I got some handouts here. Just give these up. This is all skeletal system stuff. And so if maybe when, okay. So maybe while they're here, you can be looking at this. So this is a list of the bones that we're going to learn here on the first page. It looks like a lot, but it's not so bad. The rest of this is just pictures, diagrams that you can use just to practice labeling the bones. So I'll go through all this list of bones, and we'll describe them and see where they're located on the body. Megan, okay, so let's finish up chapter 5. First of all, we got most of the way through that. We got 1, 3, 4, 5, 6, 7, 8, 9. So who's not here? Deandra, not here, I guess. But everyone else, Michaela, Rylan, Catherine, Abby, Megan, William, Mallory, Gertrude, everybody. So no Deandra. Okay, chapter 5. And we left off somewhere around here, I think. So we're talking about the different glands that are in the skin. Sweat glands, two types of sweat glands, eccrine and apocrine. Ceruminous glands are earwax glands. Cerumen is another word for earwax. And sebaceous glands, the oil glands. Those nails, fingernails and toenails. We don't need to learn a whole lot about this. The nail bed is a tissue, beneath the nail itself, and the matrix is back here where the nail grows. So it grows, as I'm sure you know it. It grows from here, and then it just moves out. Which ones grow faster, fingernails or toenails? Yeah, fingernails. I've read anywhere from 2 to 5 times faster, the fingernails compared to toenails. A toenail, like the big toenail, to grow from here to here is a year. It takes a whole year to grow a whole new toenail. Skin functions, protections, sensory, thermoregulation, vitamin D. So protection, obviously, it covers your body, so it protects against just anything contacting the deeper tissues. So physical, chemical, all those, some chemicals can absorb right through the skin. Need to be careful of that. If you are handling any kinds of solvents, like paint thinner or even gasoline, that stuff will absorb right through your skin. Used to work in a factory. We're there with these machine operators, these guys who would run these manufacturing machines, and the parts that they were machining would get very oily, and so there was a big tank of solvent at their workstations, and there was a little crane thing from the ceiling with a chain that they could move these, hook it onto these heavy parts and move them around and lower them into this tank of solvent to rinse the oil off of them, and then pull them out and put them on a table to drain. And it said right on that tank of solvent, it had that big hazmat symbol, and it said, danger, hazardous, do not contact with skin, causes cancer. And those guys, I watched them do this many times. Whenever they would take a break or go to lunch or at the end of the day to clean their hands, they would dip rags in that solvent and clean their hands with that stuff. That stuff soaks right through your skin. And it says right there it's cancerous. And these, and we have government agencies like OSHA and NIOSH and the EPA to protect us from hazards like that. They even go into factories to make sure that the factories have all the protections and signs like that telling the employees about the hazards. But some people are foolish. Okay. First line of defense against toxins entering our bodies, bacteria, viruses, ultraviolet radiation. Of course, ultraviolet radiation from the sun is in sunlight, and it'll penetrate into your skin, and when that energy hits the DNA in your chromosomes, it will cause genetic mutations. Genetic mutations in cells of your body can lead to cancer. So our skin has melanin in it that that blocks or filters that ultraviolet radiation. Skin is pretty waterproof, so it keeps water in and keeps water out. So we have different kinds of sensory receptors in our skin. The word tactile means touch. So we have touch receptors, receptors for touch, pressure, vibrations, pain, and heat and cold. So those all have, all those sensory receptors have neurons leading to the brain, so that when something stimulates those receptors, it sends the information to our brain. Thermoregulation means regulating temperature or heat. So we have sweat glands. When we get hot, we sweat. The water in the sweat evaporates, and that cools us, because every molecule of water that evaporates, it takes heat energy to do that, to make that water molecule go from liquid to vapor, and so we lose heat energy that way. When we get hot, the blood vessels near the surface of our skin dilate, they get bigger, so that increases blood flow near the surface of your body and allows the heat in that blood to escape into the surroundings. So it helps to cool us down. And when we start to get cold, our body's temperature drops, the blood vessels constrict so there's less blood flow near the surface. So we're losing less heat from that blood to the surroundings. And vitamin D synthesis. Production of vitamin D in our bodies happens at the skin, and that requires exposure to sunlight. So that's why it's recommended that we each get at least 15 minutes of direct exposure to sunlight every day, just for the vitamin D. Aging, nothing good happens to your skin as you get older. Wrinkling, loss of subcutaneous fat, that means the fat layer right below the skin, it changes your appearance. That's why as people get older, their faces, I know my face it looks thinner than it did when I was younger, just because there's less layer of fat beneath the skin. Atrophy of sebaceous glands. Atrophy means quit functioning or die off. So make less oil, less skin oil. Your skin gets drier. Less melanocytes. I've noticed that as I've gotten older. I used to get suntan real easily, but anymore I never get suntan. I could be outside all day and my skin barely gets any darker at all. Something I saw demonstrated once, and it's pretty telling about what happens to your skin. I can take the back of my skin and pull it up like a tent and let go of it. It takes a few seconds for it to go back to normal. Most of you guys, you do that, it'll snap back in half a second. It's just less collagen and elastin proteins in your skin as you get older, so it's just skin gets weaker, less stretchy and less elastic. And skin cancer. Cancer is a class of diseases. There's over 100 kinds of cancers, because it can affect just about any part of your body, any tissue or organ of the body. And what they all have in common is cancer is cells dividing out of control. We have genes that tell our cells of our body when they should divide and when they should not divide. And some kinds of cells of your body divide all the time, like skin cells, because we're always losing them. They're always falling off and rubbing off. Other cells, like muscle cells, they hardly ever divide. And that's all controlled by genes. And but so what if there's a genetic mutation? A mutation just means a change in a gene, an accidental change. If there's a mutation in one of those genes that controls cell division, then those cells with that mutation, they don't know when to stop dividing. They'll just start dividing and dividing and dividing, and they won't stop dividing. And those cells those daughter cells that are produced by that cell division, they don't become normal functioning cells of that tissue or organ. They just become tumors. They form tumors, and so these cells divide, and then those cells divide, and then those cells divide. And what causes genetic mutations is when a cell makes a mistake. And so every time a cell divides, that's an opportunity for a mistake to happen in the DNA of that cell. And so, of course, cells that divide a lot have more opportunities to make mistakes and become cancerous. So that's one reason your skin cancer are some of the most common ones, because these cells are always dividing. And another reason skin cancer is so common is because skin is at the surface of your body where it's exposed to all these environmental carcinogens, chemicals, radiations, ultraviolet, these things that cause cancer. So three major types of skin cancer: basal cell carcinoma, that's in the stratum basale, the bottom layer of the epidermis. Those are cells that are dividing all the time to make new cells. And so those are the most common, but it says rarely metastasize. What does that mean? If cancer metastasizes, spread to other organs or tissues. So it's very common, but it doesn't. It usually does not spread to other organs. Squamous cell in the stratum spinosum. So that's in the layer of the epidermis where the cells are getting thinner, more squamous. 20% of skin cancers and often metastasizes. And then the worst ones are the malignant melanomas, which is only 2%, but they do metastasize. They can spread to other organs and kill you pretty quickly. And those melanomas are the ones that are commonly affect a mole in the skin. That a mole that looks normal might start out looking normal like this, but if it becomes cancerous, it'll get wider, and this has a sharp border around it. But when it becomes cancerous, the edge or border becomes fuzzy, like that, or it kind of blends in with the surrounding skin as it gets bigger. So that's what you need to watch for in yourself and people close to you. See any changes in a mole, you need to get it checked out right away. Okay, oh yeah, burns. First, second, and third degree, the higher the number, the more serious or deeper the burn. Fourth degree is even goes beyond the skin into the deeper tissues, muscle and bone. So first degree burn is just like a a bad sunburn. It says mild pain, redness, no blisters. If there's blisters, then it would be second degree. And it heals okay, although if it happens repeatedly, that you'll get premature aging. Your skin will be accumulate permanent damage. Second degree blisters, redness. The epidermis separates, and so there'll usually be that's what a blister is. The epidermis separates from the dermis, and there will be usually some fluid accumulate in between. So edema or swelling. It'll heal on its own, but it takes longer than first degree burn. And third degree, that's all the way through the dermis. And so you'll lose feeling in the center of the burn because all the pain receptors in the skin are burned away, but it'll be very painful around the edges. Slow healing because these first and second they can the skin will just heal from underneath, but the skin's gone, so it has to heal from the outside in, and it takes a long time for the skin to do that. And so large third degree burns are treated often with skin grafts. This estimating the percentage of a body that is burned, this so-called rule of nines. For example, the arms, 9% each. So each arm the surface of each arm is about 9% of the total surface of the human body. And each leg, 18%, and so on. And these are 36. These are all multiples of 9. And so this is just used as a rough estimate this is used by paramedics and EMTs. They'll just take a quick look and say, okay, the right arm and the right leg are mostly burned. So they'll just say 9% plus 18%, and come up with a number. And that'll be the number that they radio ahead to the hospital. We got a burn patient, burned over 27% of the body. Okay, skin disorders, scars. We saw at the end of chapter 4 about how scars form. Those fibroblast cells move to the site of a cut and they fill it in with collagen, and now that collagen is there forever, and that's what forms the scar, the visible scar. Bed sores. Anyone who deals with patients in a hospital or a nursing home who are in bed for a long time, extended times, need to be careful of this. So wherever the body part is in contact with the bed, there's pressure there, and that can lead to bed sores. It can take a long time for that to heal. I've got a picture here, but taking a long time for that to heal, especially in diabetes patients, because they heal slowly anyway. So this is why you need to reposition the patient frequently. Callus, this is just a thickening. Skin gets thicker when it's when there's it's in contact or rubbing uh, frequently, like if you wear shoes that don't fit right, where they're rubbing, where your skin is rubbing the inside of the shoe, it'll get thicker. If people who work with their hands doing carpentry or digging with shovels, their palms of their hands get thick calluses. Acne, accumulation of sebum and keratin, which are normally in skin, but if they plug a hair follicle, then that can lead to a small infection. Okay, so that's chapter 5. Any questions about that stuff? Or we? So we'll, I think, do skeletal system this week and next week, I think. Well, no, supposed to do it all this week, but we're going to fall behind a little bit, but that's okay. So these 3 chapters, chapter 6 is about bone tissue mostly, and then 7 and 8 are about learning the names of the individual bones of the body. So we'll look at chapter 6 first. General information about bone tissue. So skeletal system, bones, ligaments, and cartilage. Bones make up most of the skeletal system, but the bones are held together at the joints by ligaments. Cartilage is, we have cartilage covering the ends of the bones to make them slippery so the joints move freely. Okay, so need to make a distinction between bone tissue and a bone. So bone is a tissue. It's a type of tissue made up of bone cells and the hard white mineral and the collagen fibers that run through that mineral. That's bone tissue. But a bone, an individual bone, is made up of several tissues. So a bone it's made up mostly of bone tissue, but there is also cartilage on the end. That's a different kind of tissue. There's ligaments connecting it to the next bone at a joint. It's covered with a thin layer of connective tissue. It has blood vessels inside of it, and it has nerves inside of it. So there's all those different types of, it's also fat inside, fat in there. So there's all those different kinds of tissue that make up a bone. So a bone is an organ. Okay, orthopedics, of course, that's the medical specialty of bones, joints, and muscles. So that's where you go if you break a leg or sprain an ankle or pull a muscle. Go to an orthopedist. I've have so many orthopedic injuries in my life that I should have an orthopedist on a speed dial on my phone. Okay, functions of bone. Structural framework, support the body. So without bones, I would just be a soft blob on the floor here. Attachments for muscles. So the bones, along with the skeletal muscles, are what allow us to flex and extend and twist our joints. Protect internal organs, such as the brain. The brain is surrounded by the cranium, which is a part of the skull that surrounds the brain. The heart and lungs are surrounded by ribs and the breastbone or sternum and the spine and back. Some of the lower abdominopelvic organs are surrounded by the pelvis, the hip bones. Produce red blood cells, white blood cells, and platelets. So inside of your bones is marrow, and the red marrow, there's two kinds, red and yellow, and the red marrow is where new blood cells are constantly being made by cell division. And store and release minerals. So our bones are not only structural parts of our body, but they are also used as a reservoir or a storage for minerals like calcium and phosphorus and magnesium. So we need calcium in our bodies, and phosphorus and magnesium and other minerals like that, just for the functions of our muscles and other organs all the time. But if you don't get enough or you don't get any calcium in your diet today, what will your body do? It'll just take calcium out of your bones and use that. And if that happens once in a while, it's no big deal. The calcium will be replaced, but if that goes on too long, then that can contribute to osteoporosis. Okay, bones along with muscles act as levers, and this is just an example here. So the load would be, in this case, just weights. If I was holding something heavy in my hand, then the load would just be whatever it weighs. If it's 10 pounds, if I'm holding a 10-pound weight there, that would be the load, and the effort would be the force of the muscle pulling up in the opposite direction. And the fulcrum is just the hinge, where the pivot is of the elbow. And I measured this on myself once. On me, it's about 2 inches. I can feel that tendon there, where the biceps and the brachialis muscles attached to my ulna, my forearm. And it's about 2 inches in front of the actual hinge. So I can measure, it's about 2 inches there. And on me, it was about 14 inches from here to where I would hold something like a dumbbell in my hand. So 2 inches from here to here, 14 inches from here to here, some simple physics. If you divide 14 by 2, what's that, 7, right? So whatever this is, if this is 10 pounds, then this would have to be 70 pounds. The muscle would have to generate 70 pounds of pulling force here to support 10 pounds out here. So the muscles produce a lot of force. If this was 50 pounds, I don't know if I could hold 50 pounds in one hand like that, but this muscle would have to produce 350 pounds of pulling force to support that. So the muscles have to produce a lot of force, but also the tendons that attach the muscles to the bones have to be very strong. And sometimes they snap, they break. So this is looking in the inside of a bone. This is a thigh bone, the head, the top of the thigh bone. So it has both red and yellow marrow. The red marrow is mostly at the ends, here the enlarged ends of the bones, and in the hollow shaft part of a bone like this, that's where the yellow marrow is, which is fat. Okay, bones can be put into categories based on the general shape. Long, short, flat, and irregular. long bones are longer than they are thick or wide. So a bone like this, it's longer, much longer than it is thick. So that'd be a long bone. Um, the finger bones, arm and leg bones, most of them. Um, then short bones are bones that are they're about as wide as they are long. So bones, many of the little bones of the wrist would be short bones. The ankle bones would be short bones. Um, Flat bones, bones of the skull, the cranium of the skull, they're thin and flat, and even the ribs. The ribs are considered to be flat bones. It's kind of look like they would be long bones, but they are pretty thin and flat. Um, and then irregular is just doesn't fit in any of those other categories. So that would be for example, the vertebrae, each backbone, very irregular, weird shape. Um, so we call them irregular bones. The sesamoid bone, that's not one of these categories, but sesamoid that's the patella. They are shaped like a big sesame seed. And we also have some other sesamoid bones in our body. They're um, they're little tiny bones on the bottoms of the feet, right here at the under the ball of the foot, like at the base of the big toe. There's two little bean-shaped bones there that are sesamoid bones. Um, some people have only one of them, some on each foot. Some people have two. Okay,
How detailed are we getting into bones as far as you want?
you're going to have to be able to identify all the bones on that list. Um, uh, okay, more the structure of bones. So here's a typical long bone. This is the thigh bone, and that's the femur, which is the largest bone in the body. And so we need to know the parts of a bone like this. The first, the long hollow shaft part is called the diaphysis, and at the ends, the enlarged ends like this are called epiphysis. So most of these long bones have an epiphysis at either end. One at the proximal end and another at the distal end. There's the articular cartilage that covers the end of the bones to make it slippery. This is our campus tour. Hello.
Hi,
Welcome. Come in. Come in. Come in. Okay, so what school are you from?
They're from Second Baptist Christian Academy in Hampton.
Okay, well, I'm Mr. Beck. I'm one of we have 6 biology professors here. And this is one of our 3 biology labs. There's 2 on the other side of the hall. One's for general biology, one's for microbiology, and this is anatomy and physiology. And we're in the middle of an anatomy and physiology class right now. We've just started learning about bones today. Anybody know how many bones there are in a human body? Not learned that yet? Any of you guys know? 206. Okay, so look around. We got a lot of cool stuff in here for learning about the human body. Courses like this are for students who want to be nurses or medical assistants, or we have a surgical technology program. What else are you guys doing? Anybody doing something else? Most of the nursing. But one of our newest tool is that thing standing up in the corner over there. And you guys know what a cadaver is? What's a cadaver? It's a dead body. And in some schools, especially medical schools, they'll actually have a dead body for learning about the human body. We don't have, we usually dissect pigs, baby pigs in here, but now we got this thing. Why don't you guys come over and take a look at this? So, come on and gather around so you can see the screen. So this is called an anatomage table, and it's a virtual cadaver. It's like a computer touch screen. So this is a list of the different cadavers. These are actually made from actual people who died. And so there's names. There's one named Carl, and Carla, Hans, Vicky, and Victor. And let's look at Hans. So it tells us about him. He was 71 years old when he died. He died of lung cancer. It tells us how tall he was, how much he weighed, and there's some photographs of his body, and so these are his lungs. Think that looks normal? That's cancer. Cancerous tumors there. He was probably a smoker. This shows that his lymph nodes were enlarged. The lymph nodes are part of your immune system. And so whenever you have a disease or an infection, something like cancer, your immune system is trying to fight it off, so the lymph nodes get bigger and larger. So he had enlarged lymph nodes. And anybody know what this word metastasis or metastasize? What does it mean when cancer metastasizes? It means it spreads from one organ or tissue to another. So it says he had chest wall metastasis, liver metastasis, pancreas metastasis. So his lung cancer spread to those other parts of his body. But that's what killed him. So should we look at Hans? See what his cadaver looked like? I've got it loaded already to the case. It takes a couple minutes to load it. So there he is. So he was 71 years old when he died. So that's what the outside of it looks like, but we want to see the inside, right? So first of all, I can spin him around with one finger. With two fingers, I shrink them or enlarge them or move them around. But there's different ways we can see inside of them. One thing we can do, we can look at this. So this is a list of the organ systems of this body. So your body is made up of 11 organ systems. So skeletal, muscular, digestive, respiratory, and so on. So if we wanted to look at only his skeleton, just his bones and not the rest of it, these are all checked, so you can uncheck it like this. And now just pick skeletal. And so now we just see his bones and the cartilage and the ligaments holding his bones together, but nothing else. We wanted also to see his muscles, select muscular. If we wanted to bet he died of lung cancer, so that would be, his lungs are part of his respiratory system, right? So let's look at that. So now we're just seeing, so this is his trachea, or his airway that he inhales and exhales through. And what are these? So for the lungs, right? And should we look inside of his lungs? See what that looks like. This is a scalpel. So a scalpel is a knife, right? So I just do this. Oops. Start the line. So if we want to see inside at that level, just touch on one side or the other and it'll disappear. So it disappears. Now to see inside there, I can just rotate with one finger. But that's what a normal healthy lung should look like. Pink and red. That look normal? That's what killed it. That's lung cancer. Probably from cigarettes. So, what if I wanted to look lower down in his lungs? Use this. Just got deeper and deeper. I'll do that. Go back to this whole body. What else? Just take another, call this a section here. Here, and then touch here, and top of his head disappears. See his brain. If I wanted to touch deeper, again, I could use this scale bar. There's also this scroll bar. This is one. We've only had this. We've only been using this a few weeks, so I'm still learning. There's a lot about this that I don't know yet. But, so there's Hans's whole body, but if I wanted to remove his skin, I could just. So it removes his skin, then his muscle, then his. I keep going over. Now let's remove his ribs. Now we're down to his internal organs. It's just his heart and lungs and nerves. It's just like peeling off layers one at a time. It has not only human cadavers, but over here, there's a bunch of other stuff. If you look on this, there's a whole bunch of different animals in here. Monkey, dog, cat, dog, mouse. course, just parts. You want to just look at a gorilla knee, a gorilla foot, different breeds of dogs. The Spaniel, French Bulldog, German Shepherd, Golden Retriever. So this would be good at veterinary schools, people studying to be veterinarians or animal doctors. We can have monkey. It's a rhesus monkey. So we do the same kind of things with him. Inside of him. There's his brain. It's taking cuts to leave him deeper or lower and lower. So, why don't you guys tell me? Anybody want to? You won't hurt it. Somebody push somebody else. Nobody wants to do this shot? What do you think of it? How much do you think this costs? Think it costs this much of the car? 2 cars? 3 cars? 3 cars maybe? It's I think it was something like $80,000, $80,000 to $100,000. Yes. So big investment, but it should be really useful for a long time. And any of you guys interested in science? Any of you hate science? You say yes if you have. Anybody wants to be a nurse or doctor or chemist or biologist? You're not into this. Other things we can do, we have pieces we can turn sideways, easily that way, or top down, go back to straight down. I don't even know what a lot of these other pieces are. This one is dissecting, but I haven't really learned how to use it. I think you can take a cut there and then touch there. Now feel remove the first layer, remove the skin and hair. Taking out of here. So select structure and remove layer by layer. Okay, so then it tells you what it's removing. So remove the hair, so now we see skin. Now we're down to a layer of muscle. External abdominal release muscle, this is the muscle that we have. They run in this direction. The skin. Now we're into the rectus abdominis muscle. Those are the 6-pack muscles. Another layer of muscles into that. Now we're into the stomach. The that's part of the small intestine. That's also part of the small intestine. Pancreas, that's an organ that's a little bit below this and behind the stomach. Diaphragm is a big muscle that the breathing muscle that enlarges our lungs to inhale. Again, part of the small intestine. And this is a vein that goes to the liver. Now we're back into the backbone. So it just keeps going farther and farther back, just removing one layer of tissue or organs at a time. Now back muscles. This is a big blood vessel. So, I can do that. So, nobody wants to play with it? How about teacher? Teacher want to play? Okay. Do you want to see anything else in our lab while you're here? We got a big full-size skeleton model there that we're going to be using today. Take a look back here. These are real human skeletons. This cabinet. How much time do you have?
I think I heard goes shortly. I really did just want to show them this and let them know what different degrees I
Okay. So, God, I'm glad you came. Thanks for coming. Hope you'll choose to come to college here. Years. I won't be here. I'm retired. But, it's a good college. I don't think very many community colleges in North Carolina have this. We might be the only one. I don't know.
Have any questions, Mr. Beck? Okay. Thank you, Stephen.
You're welcome.
Thank you, thanks for letting us do that.
I don't think I turned any of them into science majors. Not very enthusiastic about it, were they? Well. Yeah, they got a few years to decide what they want to do. Had a group Tuesday. We had 3 groups of Richmond County Middle School kids come through. Same thing, had 20 minutes with each group. And the third group, I mean, they were really into it. They were really excited. They wanted to play with it and stuff. But the third group, one of the kids said, if I come here and take your class, I was wearing this lab coat. He said, would I get to wear wear one of those coats like you got? And I said, yeah, I said, there's a bunch of them in those top drawers back there. And he looked back and said, can I put one on? And I said, I don't care. So the whole group of 6 of them ran back there and pulled lab coats out of those drawers and put them on. And were taking selfies to show their mom and taking pictures of each other. That's what, I mean, they like that, but that was what they really got excited about, putting lab coats on and taking selfies, which I think is great. Maybe, I mean, you never know what's going to hook a kid. One of those kids might remember that, 5 years from now and come here for that reason, just because he had such a fun time here that day. Okay, so we were talking about parts of this long bone. The shaft is called diaphysis. The epiphyses are the ends. So in the epiphysis, that's where this red marrow is, and this is called spongy bone because it's like a sponge. It's got a bunch of little hollow spaces in it, and that's where the red marrow is. The bone out here on the surface, that's called compact bone. That's the dense, hard, strong bone. Um, and the diaphysis is hollow. That's where the yellow marrow is, and there's blood vessels running through there. So this is adipose or fat tissue. Um, oh, uh, uh, Then in between the diaphysis and the epiphysis at either end is this little zone called the metaphysis. And um, what's important about that is that that's the location of this thing, this epiphyseal line. So this would be in an adult bone, but when this person was a child, this would be called the epiphyseal plate here. And that's where the bone grows in length. So when a bone like this gets longer, when a child is growing, the bones get longer. The whole bone doesn't stretch. It only grows at these two places near the ends. This epiphyseal plate here, and there will be another one about here. And that's where the bone gets longer. It adds length. Only at those epiphyseal plates. Those are also called growth plates. And so the bones in your bones, when you were a fetus, your bones start out as cartilage and then they harden into bone. But these epiphyseal plates, they're still cartilage, and that's where the growth happens. Once the person is done growing, by the mid or late teens, then the epiphyseal plates they harden into bone, and now it's still visible on an X-ray, and it's called the epiphyseal line. So the epiphyseal line is just what's left over from what used to be the epiphyseal plate or the growth plate. Okay. What else? Oh yeah, another thing. The whole bone is covered with, yes, shown here, it looks like some peeling off of the bone. It's called the periosteum. That's a layer of connective tissue that covers the bone. And the ligaments that would connect this bone to, well, in this case, it would be connecting the thigh bone to the shin bone here. There would be ligaments connected to this bone and then to the shin bones. Those ligaments are made of the same connective tissue, so this bone is covered with this connective tissue, but that connective tissue just continues on as ligaments and to attach to the other bone at that joint, in this case the knee joint. Okay. Talked about this stuff, growth plates. Those growth plates, because they are cartilage in there, that's a weak point, a weak spot in a bone, and so if a kid breaks his arm, it often happened at the growth plate. And I used to have a essay question in my online, maybe I still do. When I teach this class completely online, they get an essay question on Moodle every week, and the essay question for this chapter was, there was a guy who noticed that one of his arms was shorter than the other. Like when he'd buy a shirt, one, seemed like the sleeve on one shirt was on one arm, or one sleeve was longer than the other. But it was actually one arm was longer than the other. And he had broken his arm when he was a kid, the arm that is shorter. So what happened? What explains the difference in arm length? And the answer was, if he broke his arm here at the epiphyseal plate, the growth plate, and then that healed, but where it healed, it didn't. The growth plate didn't grow anymore after that injury. So if that like happened to his right arm up here, that growth plate wouldn't grow anymore. The one at the distal one at the other end of his arm, it would continue growing, but if that happened when he was 10 years old and his arm grew 2 more inches after that, it was supposed to grow 2 more inches. This growth plate might grow 1 inch. This growth plate didn't, so this arm would end up 1 inch shorter than the other arm because of that. And that does happen sometimes to people sometimes. If they break a bone at a growth plate, they'll end up with one leg shorter than the other or one arm shorter than the other. Okay, features of bones, the words that we should learn. Some of these are not so important as others, but certainly you need to know this word, articulation. The articulation is just a joint, and that's why the cartilage at the end of the bones is called articular cartilage, because that's at the joint, to make the bones slippery at the joint. The word head just means a round part of a bone, like on this femur bone. This is called a head, the head of the femur bone. This would be called the neck in that case. So how narrow this is here. Older patients who pretty commonly fall and break their hip, that's where it often breaks, along the neck there. A facet just means a flat surface. That word is used to describe diamonds. I don't know anything about diamonds or jewelry, but I know that when a diamond is cut, they cut it, and I don't know. It's made up of a bunch of flat surfaces, right? And each one of those flat surfaces is called a facet of that diamond. So, an example. We got pictures of some of this stuff. A facet. Well, on the vertebrae, these backbones, they have discs in between them, and the surface of the bone that has the discs in between, that's a flat surface, and so that would be called a facet of that vertebra, that backbone. Condyle, rounded surface, usually at a joint. So this skull has some condyles. Like this hole is right where it sits on top of the spine, and I can do this with my head, turn it, rotate it, and do this and this, and it's because there are these condyles, these rounded surfaces at the joint where this sits on top of the top vertebra here. Uh, the word process is kind of weird. That what that means in anatomy. In anatomy, a process is something sticking out. So a bony process is part of a bone sticking out. So this collarbone here, it has this part sticking out here. That's called a process. Um, the the each vertebra has a part sticking out, and you can on me I can feel that I can feel that it's called a spinous process. I can feel that on most of my vertebrae. Um, a tubercle, a small rounded process. So that's and a tuberosity is a rough surface. A crest is a ridge. Fossa is a groove. Like fossa is a groove, usually part of a joint. A fossa on this skull, for example, where the this this temporomandibular joint between the jaw and the skull is the jaw has a couple of condyles, these rounded surfaces that fit into a fossa on either side, a rounded groove to make that joint. A fissure, the word fissure just in generally means a slit or a cut through something, but in anatomy, a fissure is a slit through a bone. And if you look at this skull, you can see in the eye sockets, there's a couple of slits in there, and that's where the optic nerve goes from the eye to the brain through those fissures. Foramen, you need to know that word because foramen just means a hole, and a good example is this big hole in the face of the skull. That's called the foramen magnum, which literally just means, what does magnum mean? Magnum means large. So foramen magnum just means big hole, a big hole. What's that hole for? I think you swallow through that? Or that's where it sits on top of here. So that's where the spinal cord goes from the brain down through the spinal column. Okay, meatus, an opening into a canal. I only know of one meatus, and that's the external auditory meatus. And so that's just the ear holes. In the side of the skull here, there's a hole that leads into the eardrum is back in there, in that external auditory meatus. And then a sinus, air-filled space. So that's what the nasal sinuses are behind the nasal cavity. They're just hollow spaces in the skull back there. Okay, so here's just some examples of some of these features of bones. Okay, there's a few different types of bone cells. Osteocytes are the main bone cells, but there are also osteoblasts and osteoclasts. And these words, blast and clast. A blast is a cell that produces something. Remember we learned about fibroblasts. They're the connective tissue cells that make the collagen fibers. So these are osteoblasts. So they produce bone tissue and the minerals and collagen fibers that make up the bone tissue. Osteoclast, a clast is a cell that breaks something down. So these are bone cells that break down bone tissue and reabsorb it. So So when it breaks down the bone tissue into calcium and phosphorus, then it puts that calcium and phosphorus into the blood. So well, these osteogenic cells are cells, the stem cells that can produce osteoblasts. A stem cell is a cell whose only job is to divide to make more cells. So these are cells that just divide to make more osteoblasts. But these cells are working constantly in our bone tissue. There's a process that goes on for your whole life in your bones called bone remodeling, in which your bone tissue is constantly being broken down by osteoclasts and being rebuilt by osteoblasts. And this is going on, it's normal, it's going on every day of your life. And so that's why it's, I forget how long it takes, but after a certain number of years, your whole skeleton is replaced. So the bone tissue you have now, 10 years from now, that'll all be different. It will have all been broken down and replaced by new bone tissue, just gradually. And this is why, this is how braces on teeth work, that orthodontists put on teeth to move the teeth around in the jaws. If we didn't have this bone remodeling happening, then those braces wouldn't work. It would be like if I had a piece of wood here, and I put a nail in it here and a nail here, and I put a rubber band around them, pulling them together. If I come back in 6 months, would those nails be closer together? No. But so if your bones were not constantly being broken down and rebuilt, then teeth wouldn't move. But because of that remodeling, bone remodeling going on, that as that's happening, that allows the teeth to move in the sockets a little bit. Okay, we talked about difference between compact bone. That's the bone on the outside that's dense and strong. And the spongy bone is on the inside that has a bunch of little spaces in it where the red marrow is. So bone is mostly compact bone. Okay, again, different kinds of bone cells. Okay, the compact bone. If we would take a cut through some compact bone, like, let's look at these diagrams, I guess. Take a cut. If we would look at this compact bone here, look at that cut through a microscope. It would look like this, something like this, or like this. So these it looks like rings of a tree. If you cut through a tree trunk, you see rings. So the bone tissue is like a bunch of these tree trunks with rings just side by side, and this is a hollow channel or tunnel down through the center of that, and there could be blood vessels or nerves running through there. And each one of these sets of rings is called an osteon. What's that word? An osteon, or another name for it is a Haversian system. And the osteocytes, these little dark spots are little hollow spaces that have the bone cells in them. Okay, the spongy bone is made up of a bunch of little tiny bony fragments called trabeculae. Um, and so there are little spaces in between. And that's where the red marrow is, mostly in the ends of long bones. Um, um, you should get some bones out. Um, well, let's take a break now. Take a break. Meanwhile, I'll get out some of these. We got real bones in here that you can. Some of them are broken, and you can see the spongy bone inside. See what we're talking about.
Just to take a break, right?
Kind of enthusiastic as those little kids. It's about how I feel today. These are all real bones. There's a bunch of plastic ones. All these are other kind of bones.
Did he say break or no? What's the one you say?
left on this chapter?
All these flags got broken. I'll let you knock it on the floor.
You said these are real bones. Did you say these are real bones? So if I took a bone out of my body right now, this is like about how heavy it would be the same.
If it's dried out, yeah.
These are the, two bones.
Yeah. I got 7 pounds. Those are not counted as part of the 206 bones. Yeah,
Or bulging. That's what causes the sciatica from the patient.
that's one cause of sciatica, you know.
Those discs ever refill or once you lose them, that means you lose them.
Oh, yeah, they get thin and will be going.
Okay. Can you go back to normal or they kind of refill?
I think they do that, and there's surgery for that, but I think they can. That's reversible by side in some cases.
Everyone back. Okay, well, let's move ahead here. Where were we? Yeah, spongy bone and compact bone. There are a lot of holes many bones have holes through them, like this, and that's where blood vessels and nerves will pass into or out of the bone. You'll see on your skulls, on the lower jaw, there's a couple holes left and right, called mental foramen, and that's where blood vessels and nerves pass through. Okay, ossification. Need to know about ossification. Ossification just means making bone, formation of bone, and there's two kinds: intramembranous and endochondral. Intra means within, so intramembranous ossification just means within membranes. And so that's how a lot of flat bones, like the bones of the cranium of the skull form, started out as membranes, and then the membranes laid down bone tissue and hardened into bone. So intramembranous, within a membrane. This is also, this intramembranous, so this is how the bones originally formed in the fetus, but it's also how bones get thicker. Remember that bones are covered with that periosteum, that layer of connective tissue. So when a bone is getting longer at the growth plates, it's also getting thicker, but it gets thicker by intramembranous ossification. It's covered by a membrane of connective tissue, and that connective tissue is adding more bone tissue onto the surface, making it thicker as the bone grows. Endochondral means, chondral means cartilage, right? So these are bones that started out as cartilage, and then they harden into bone. And even when a baby is born, the bones are still a little bit rubbery. They're not completely hardened. So this is so the bones of a fetus developing, this is actually made of cartilage, and it looks like a bone, but it's made of cartilage, but then it hardens in the bone. The epiphyseal plates or growth plates, they remain cartilage throughout the growing years of the child, and then it hardens in the bone and becomes visible as the epiphyseal line. Okay, I talked about this stuff. Growth plates, bone remodeling, I already talked about that. So during this bone remodeling, breaking down bone tissue and rebuilding it, that's constantly going on. This is where, if you don't get enough calcium in your diet, then more calcium will be taken out of your bones than is put back in during this bone remodeling. So this is, so that's why if that goes on very long, you don't get enough calcium in your diet, then your bone remodeling is just going to continue taking calcium out of your bones, not putting as much back in during the bone remodeling, and so your bones will just get weaker. You'll lose bone mass. So here, so 5 to 10% of your skeleton is remodeled annually. So as much as 10% of the bone tissue you have now is new. It's been replaced in the last year. Okay, fractures. How many of you guys have broken a bone? You want to share what you broke? Oh, yeah, I've done that. Football. I did it on a bicycle. Went over the handlebars and when a broken bone is treated by an orthopedist, if they can set the bone without surgery, that's called a closed reduction, and if they have to do surgery to get to the bone, that's called an open reduction. The open reduction is often done if the bone is broken into more than two pieces. Like if there's some fragments in there, they have to screw them back together. This word reduction or reduce in orthopedics means to put a bone or a joint back or to realign it. So if a shoulder is dislocated, putting that shoulder back in the joint is called reducing that joint or reducing that dislocation. So different kinds of fractures. Just look at pictures. Yeah, so closed means that the skin is not broken, so the bones are not exposed. It's also called a simple fracture. But if the bone is poking out through the skin, that's called an open fracture or a compound fracture. I had a compound fracture once of my right shin bone, or no, it wasn't. It was a fibula, the slender bone, not the. So there's two lower leg bones. The big one is the shin bone or the tibia. The fibula is a smaller one. That's the one I broke on my right leg. It broke right about here, and it wasn't because the bone poked out through the skin. It was because I was rock climbing and I took a long fall, landed on a ledge, and there was a sharp rock, edge of sharp rock that cut into my leg through the muscle, and that rock hit the bone and broke it. So, but so the bone was never sticking out. It was just exposed through that deep gash made by that sharp rock. But that was considered a compound or open fracture. Um, uh, Transverse fracture just means broken just straight across. It's like a transverse section is just straight across. Spiral spiral fracture is usually caused by some kind of twisting force on the leg or the arm. Comminuted means fragmented, just broken into several pieces. And then impacted, this is what would happen if like you fell a long distance and you landed with your legs straight, and the impact would it's like the impact would be in this direction. That would cause the bone to break. And then a green stick fracture, an incomplete fracture, it's only partway through. And this happens mostly to kids because their bones are not fully hardened yet, and their bones can bend. It's called a green stick because it's like a green living tree branch. You bend it, and if you break it, it doesn't break all the way through like a dead, dried out tree branch. It'll just break partly through. So that's what happens to kids' bones sometimes. And then oblique just means at an angle like this. Instead of straight across, it's at an angle. Okay, so how does the bone repair? How does it heal? There's 4 steps here, and they're shown here. So first thing is the bone has blood vessels in it, so it'll bleed internally, and it'll form a big clot called a hematoma. A hematoma is just an accumulation of blood inside the body somewhere, and so that clot will form around the break, and then there will be cartilage will form around the break, and then the cartilage will be replaced by spongy bone, and then the spongy bone will be replaced by compact bone, and then it's fully healed. So there's a hematoma, and then the cartilage, and then the spongy bone, and then the compact bone. Okay, and that's visible. That's visible as in an X-ray. A doctor can look at a bone in an X-ray and tell if it's been broken in the past. Okay, exercise in bone tissue. Moderate weight bearing on bones is stimulates bone growth. So weight bearing exercise is good for your skeleton. Walking. It puts weight on your spine and your hips and your legs and feet bones, and just weightlifting. Doesn't have to be real heavy weights, but just a little bit of weightlifting with dumbbells or something is good for your arm and upper body muscles. Any moderate stress to your skeletal system is good for it. It stimulates growth and maintaining bone mass. This is why people who are invalids or bedridden for months and months, they lose, their skeletons get weaker, tend to get weaker. Um, um, okay, nutrients, of course, calcium, other minerals, magnesium, fluoride, vitamins, vitamins, vitamin D. When we study hormones, vitamin D it functions as a hormone in our bodies that causes more calcium to be absorbed from the food we're digesting into our blood. That's why if you buy a bottle of calcium tablets at Walmart or CVS, many of those uh, calcium supplements will also have vitamin D in there, along with the calcium in the same capsules, because um, the vitamin D will cause your body to absorb that calcium into your blood, which is what you need to happen. Okay. Omega-3 fatty acids, those are the healthy fats that are in some fish like salmon and mackerel and sardines, oily fishes like that. And it's also in, what else? Flax, and what else? Anybody know? Flaxseed has it. Okay, calcium, of course, because bones are mostly, the white minerals in bone tissue is mostly calcium, so of course it's important. But when we study muscles, we'll see that calcium ions are necessary for muscles to contract. Muscles cannot contract without calcium. It's part of the process that triggers muscles to contract. Okay, I want to get through this stuff. Osteoporosis, loss of bone mass, uh, increases with age, happens more in women, um, uh, partly because women's skeletons start out smaller to begin with than men's. Mostly they have less bone mass to begin with. Also, after menopause, the ovaries stop producing the female hormone estrogen, and estrogen, along with other hormones, stimulates bone growth. And so without estrogen, just there's a tendency to lose bone mass after menopause. So the bones get weaker, fractures that's a risk factor for fractures. Height loss. My mom, when she was young, she was 5'2", and by the time she died, 3 years ago, she was 4'11". She lost 3 inches in height. Part of that's from bone loss from osteoporosis. Also the discs. Each one of these discs get a little thinner as we age, and so you lose some height that way. Okay, some people actually have bone pain and their posture changes. They get a hunched back appearance. Risk factors for osteoporosis. Genetics, of course. If your mother and your grandmother had osteoporosis, chances are you're more at risk for it. Smoking, inactivity, small build, European or Asian ancestry. Alcohol, diet low in calcium or vitamin D. Can't do much about the genetics or your ancestry. Once you once you get osteoporosis, it's really hard to reverse it. So you should make sure you're getting calcium in your diet throughout your life, because if you don't, and then you get osteoporosis, it's really hard to put it back, to reverse the osteoporosis. You can't just start taking calcium after you have osteoporosis and expect osteoporosis to be reversed. It doesn't happen that way. So like a lot of things, it's better to prevent it than to try to cure it after the fact. Okay, so it's comparing normal, healthy bone on the left and osteoporotic bone on the right. Okay, so that's the end of chapter 6, which is a general information about bones. Now we need to start learning the names of the bones. That's the fun part. And everybody got that list, so that can be used out as a checklist. Like check them off after you learn them. So the human skeleton can be divided into the axial part and the appendicular part. The appendicular means the appendages. The arms and legs are the appendages. So that includes the arms and legs and the bones that attach the arms and legs to the body, which is so the hip bones attach the legs to the body. So the hip bones are part of the appendicular skeleton, and the scapula or shoulder blades and the collarbones or clavicles, they attach the arms to the body, so they are considered part of the appendicular skeleton. But everything else, the skull and the neck and the whole trunk or torso of the body, that is axial. So the center part is the axial. So the handout has the bones divided into axial and appendicular, because that's the way they're divided in chapters 7 and 8. Axial. One chapter is on axial, the other is on appendicular. But so here's the bones, the list of the bones. So the hardest ones to learn are the skull, the bones of the skull. So there's eight cranium bones. The cranium is the part that surrounds the brain, and then the rest are the face bones. So we should go through them, and there's some skull diagrams in your handout that you can practice labeling these bones. And don't make the mistake that a lot of students make. I think they think that they don't need to study these bones in lab. They'll just study the pictures, and then they come in for the lab practical, and the real model of a skull in 3 dimensions is not the same as the pictures. It doesn't look the same. So you might, especially the pictures in here, has these nice sharp lines here separating all the bones. It's not like that on a skull model or a real skull. It's hard to tell where one bone ends and the next one next to it begins. It doesn't have nice dark lines drawn on it like these pictures. And these pictures are color coded. Again, makes it real easy to tell one bone from another. But then you look at that skull model on the lab practical, it doesn't look like that at all. And a lot of students do terrible on lab practicals because they did that. They think they could just study the pictures at home. But where was that list? Okay, so these auditory ossicles, the word ossicle just means little bones. These are the little 3 bones in either the middle ear, the malleus, incus, and stapes. We're not going to learn them in this chapter, this week. And these carpal bones, these are the wrist bones, and each wrist has 8 little bones in it. There's 8 little bones here at the base of the hand, and each one of them has a name. And if you take Anatomy 1 and 2, then you have to learn the names of each one of those 8 bones. But in this basic anatomy class, all you need to learn is the word carpal, the wrist bones. You don't need to know the 8 names for them. Same with these tarsals are ankle bones. There's 7 in each foot, and each one has a name, but you don't need to learn them. You just need to learn tarsals. The tarsals are the ankle bones. So you guys have to learn the whole body in one semester, so you don't have to learn quite as much detail as the Anatomy 1 and 2 students in some cases. So here again, our list, it should be the similar to the list that you have on the handout. It tells us how many of each. In many cases, there's a left and right, but in some cases, there's only one. So there's 206 bones total, but you don't have to learn 206 names of bones because already seen that there's 16 bones. You need to only learn 1 word for 16 bones. Only need to learn 1 word for 14 bones. And the phalanges, those are the bones of the fingers and toes. And so each finger has 3 except for the thumb that has only 2. So that's 3 times 4 is 12 plus 2, 14 in each hand. So 28 for both hands. Same thing with the toes. 3 phalange bones phalanges in each toe, except the big toe has only 2. So there's another 28. So 56, 28 in the feet and 28 in the hands. That's 56 bones, just 1 word, phalanges. Phalanx with an X is singular. This is plural. Right. And the vertebra, the backbones, 26 of them. A stack of 26 bones, and you don't have to know a different word for each of them. So that's 1 word for 26 bones, vertebrae. Although you do have to learn cervical. There's cervical vertebrae in the neck, thoracic in the chest, and lumbar down below. We have to learn how many of each of them. So anyway, we need to start learning these names, bone names. So you each have I gave each of you a real bone just so you could see the compact bone, and each one of these is broken somewhere, so you can see some spongy bone inside, see what that looks like. But each of you also have a skull, so we need to start learning the bones of the skull. So start with the. Well, let's look at the picture. Frontal bone, that should be easy. It's right there in front. The forehead is a frontal bone. Just 1 frontal bone right here. Then behind that, there's a left and right parietal bone. Let's find a side view. So here's the frontal bone, only 1 of them. But then a left and right parietal bone. So this would be the right parietal bone we're looking at. So that's this one. It covers the whole top half of the cranium on on either the left or right side. If we continue back, on the back and bottom of the skull is the occipital bone. Occipital, and that bone includes that big hole. The foramen magnum is in the occipital bone. Then if we move down here, like below the parietal bone here, fairly large bone is the temporal bone. So that's right on the side of the head, and that includes the external auditory or acoustic meatus. So that's the ear hole. So you see the ear hole. The ear hole is in the temporal bone. So the temporal bone is all of this with the ear hole included. It also includes this fossa, this groove where the jaw, the joint for the jaw, is also part of the temporal bone there. So right in front of the temporal bone is the sphenoid bone. I've read this described as shaped like a butterfly. I don't really see a butterfly there, but I guess if you use your imagination, it might. So that's right in front of the temporal bone. And so there's one frontal bone, a left and right parietal, a left and right temporal, but this sphenoid bone, does it tell you quantities? Yeah, it tells you on here that there's only one sphenoid bone. And looks like this would be the right sphenoid bone, and there would be another one on the left, but that's one bone that goes all the way through. And you can see it on both sides, but there's only one of them, that's sphenoid bone. What's in front of that is this bone, this cheekbone here. It's called a zygomatic bone. And so I have the zygomatic process, and yeah, the zygomatic arch. Yeah, so this is all temporal bone, and the zygomatic arch is this. You see this hole? You can put your finger through that hole. That's called the zygomatic arch, that bone there. And that is formed by, this is all temporal bone here. So half of the zygomatic arch is temporal bone, and the front part is zygomatic bone. So, so this is all temporal bone here, and then zygomatic bone here. And it's just kind of weird that the front, that this is called the zygomatic process of the temporal bone, and this is called the temporal process of the zygomatic bone. And so those two make up the zygomatic arch. Okay, what else on the skull? So ethmoid. The ethmoid bone, this one, you can see it in the eye socket, on the medial side of the eye socket here. And again, you can see it in both eye sockets, but there's only one ethmoid bone. So it passes through, like right above the nasal cavity here. And so, but you can see it on both sides. There's only one ethmoid bone. The lacrimal bone here, it's a small bone, but you see that little, in the eye socket here, there's a little hole there next to the nose on either side, either eye socket. And that's where the tear ducts are, the tear glands. And But that, where you see that hole for the tear ducts, that is in the lacrimal bone. So this is lacrimal bone with that hole for the tear ducts right in there. Then there's the nasal bone, right, the bridge of the nose, and it tells us there's two of them. So the left and right, little pretty small bone there, nasal bone. And then, well, all of this here that includes the upper teeth. That's the maxilla bone, and there's a left and right maxilla that makes up. It's like the upper jaw. It includes the upper teeth. Then the lower jaw is just one big bone called the mandible. My skull doesn't have one, but that's the whole lower jaw, just one big bone called the mandible that form the joints here. So this is called is it on there? Does anybody know what this joint's called? Ever heard of TMJ? Temporomandibular joint. It's called temporomandibular because it's between the temporal bone and the mandible. And there's a condition called TMJ syndrome that some people get. They have a sore jaw joint, and it might get locked, and so it's called TMJ, temporomandibular joint syndrome. I used to work with a guy at a job before I came here. We taught anatomy and physiology together. I think I taught lecture and he taught lab, and he was a retired orthodontist, and he told me that he had a lot of TMJ patients, and the way he could almost always fix it was just grinding down some of their teeth so that their teeth would come together the way they're supposed to. If their teeth, upper and lower teeth, were mismatched, they would come together and it would make the jaw crooked, the joint, and cause inflammation. Okay, what else? Just a couple, well, like three more. No, two more. Three more. But if we look in the front, inside here, these nasal concha bones here, these are inside. You can look inside the nasal cavity, the opening of the nose hole, and you see on the sides, there's these little bones, like little bones here and here on left and right side. Those are called nasal concha bones, and those their only function, I think, is just to have more surface area for mucous membranes and sense of smell. So we got smell receptors on those surfaces. On an animal like a dog, they have tremendous amount of these nasal concha bones in here, all curving and folded up inside of there. So the amount of area in your nose that is covered by olfactory sensors or your smell sensors, it's about the size of a postage stamp in there. But in a dog, it's about the size of a bandana, all folded up in there on those concha bones. That's why they have such an incredible sense of smell. And thus, the part of their brain that receives the information from all those smell receptors is huge compared to a human. So, in some ways, animals like dogs are way more intelligent than we are. But, they're different kinds of intelligence, and if you consider awareness of your surroundings to be a type of intelligence, which I think it is, your dog is way more intelligent than you could even dream of being. they have such a sense of their surroundings, just from their sense of smell and their hearing, and they're just always so aware and looking around and smelling and hearing. How many people do that? I mean, you see people walking across this campus. Most of them are like this. Look at their cell phone. Have no idea what's going on around them in their environment. Um, okay. Um, yeah, down right in the middle. Yeah, this vomer bone. You look right in the center of the the nasal cavity. Um, the lower part of this wall here is called the vomer bone. And if you look at the bottom of your skull, like this, you can see the vomer bone in there from the bottom. The same vomer bone that you see from the front, looking in the nasal cavity, the nasal opening. And what else? There's the palatine. So the palate is the roof of the mouth, right? The palate. But so all of this is called the palate, but most of this is maxilla, part of the maxilla bone that has the teeth. But only the back part of the palate is made up of the palatine bone. So if you look at the roof of the mouth, the back part of the roof of the mouth is the palatine bone that you can see there. I think that's all for the head, for the skull, right? Anything else? Under mandible, it says mental foramen. That's the little holes on either side of the chin called mental foramen. The word mental comes from mandible. And foramen means hole. Under occipital bone on your list, it lists the foramen magnum as a feature of it, that big hole. And on either side, there's those round, smooth surfaces. Those are called the occipital condyles. Those make for a nice smooth joint sitting on the top of the first vertebra, so you can move your head in many different directions. You can turn your head this way and rotate it this way and like this because of those occipital condyles. Here and here. Okay, more features of the skull is the sutures. The sutures are these joints. They look like wavy lines on your skull models. As William and I were talking earlier, as a person gets older, those sutures, they just fuse together like through the whole. This becomes all one bone. But these sutures have names. This one down the middle is called the sagittal suture. This one between the occipital bone, we're looking at the back here. Between the occipital and the parietal is called the lambdoid suture. And then where's the other one? Yeah, the coronal suture is this one between the frontal bone and the parietal bone. So coronal, sagittal, which is right down the middle, and the lambdoid. Lambdoid is here. Oh yeah, there's another one, squamous, between parietal and temporal squamous suture. Okay. Okay, well, let's just continue down the list. The hyoid bone, this U-shaped, shaped like a letter U on this guy, that's this one here. Um, uh, this is the only bone that's not directly attached to any other bone. It's just it's uh, it's got muscles in it that are attached to the tongue, but it's just like a free-floating bone. And how do you think a bone like that in that location, like it's right there, um, right there, like in the notch here, right below your chin here. If that bone was fractured, well, like if a patient turned up dead and couldn't figure out what killed him or her, except had a fractured hyoid bone, what would you suspect? Ever watch crime shows? What is it? Yeah, manual strangulation, which means somebody put his hands on there and strangled that person and fractured that hyoid bone. There's not many other ways for that to happen. You're not going to fracture your hyoid bone falling out of bed or playing football. It's possible, but no, one way is something called if you're clotheslined, they call it. Like it's what they call if you're riding a motorcycle and you hit a clothesline or a chain or something stretched across a driveway. That could hit you in the hyoid bone. But if someone's died and the fractured hyoid bone, the police immediately suspect strangulation. Okay, okay, the bones of the spine, the vertebral column or spinal column, that's just a stack of bones of the backbone. And we said there's 26 of them. And you have to know how many cervical. The word cervical means neck, right? The cervical collar is that support collar for somebody with a neck injury. So cervical, there's 7 of them. And then lumbar, there's 12. And then, thoracic. The word thoracic means at the level of the chest. Thoracic means chest. So there's 12 thoracic, and then only 5 lumbar. So the way we learn, everybody remembers them, is the time that people eat their meals. Although I don't know if anybody really does, but breakfast at 7, lunch at 12, dinner at 5. I'm lucky if I eat dinner by 9:30 most nights. But that's how you remember 7, 12, 5. And also, how many pairs of ribs are there? Well, and that's because, a good way to remember that is every thoracic vertebra has a pair of ribs attached to it. So if there's 12 thoracic vertebrae, there must be 12 pairs of ribs, right? So if you remember one, you should remember the other. The vertebral column sits on the sacrum, this triangle-shaped bone, and then the coccyx is a little tailbone right below that. These vertebrae are numbered from top to bottom with the letter C for cervical, T for thoracic, L for lumbar. In between are the discs, these intervertebral discs. Inter means between, so that's these cartilage. It says fibrous cartilage. And there's also these curves. The spinal column is not straight. It's got curves. It's got these curves of cervical. It's like a the letter C, a little bit curved this way. And then the next one is the thoracic curve, and it's curved the opposite way. And then the lumbar is curved this way again. And then the sacrum, so it's like a C this way, and then a C this way, and then a C this way, and a C this way. Letter C. There's words for the excess curvature of in the lumbar. If it's curved too much this way, there's a term for that. Anybody know that? What that's called? Lordosis. The hunchback kind of appearance, that if the thoracic vertebrae are curved this way too much, that's called, I think that's called kyphosis. And what if it's curved sideways? That's scoliosis, right? Scoliosis. I remember when I was in high school, in high school study hall, there was this mean lady, study hall. Her whole job was just study hall monitor. I mean, no wonder she was mean. She had to put up with that stuff every day. But I remember she yelling at kids to sit up straight. She'd, sit up straight. You're going to get scoliosis. Okay, we talked about that. Okay, something that will definitely be on the lab practical is there'll be this, exactly this. A cervical vertebra, a thoracic vertebra, and a lumbar vertebra sitting on a table, and you'll have to say which is which. Which one's cervical, which one's thoracic, and which one's lumbar. How do you tell? There's only one feature you have to look at, and that's size, because they're small at the top, and they just get bigger and bigger and bigger and bigger and bigger and bigger and bigger. And it's because the lower it is, the more weight it has above it, the more weight it has to support above it, so the bigger it is. You can look on this guy, see that the lumbar vertebrae are noticeably bigger than the thoracic, and the cervical are smaller than that. See, so every vertebra has this hole through it, so that there's a continuous tunnel through this whole spinal column, and that's where the spinal cord is, part of the central nervous system. We don't need to learn much more about all these names for all the parts. We don't need to learn all that stuff. So there's a disc in between these flat surfaces called facets. So this cartilage holds the bones together and also provides cushioning and also some flexibility, that each one of these joints can twist just a tiny bit, but because we have 26 vertebrae with discs between all of them, you can twist your whole vertebra, your whole backbone pretty much. Each one twists just a little bit, and when a disc, it can bulge out, and it's called a herniated disc. That used to be, people used to call that a slipped disc, because it was thought that the disc could slip out from in between the bones, but that doesn't happen. This is really tightly glued on there. It can't slip out, but it can bulge out. So these discs I mentioned earlier, they get thinner as we get older. But since we're on the subject of back, I'm going to tell my story. When it was like 20 years ago, more than that, I guess. But for several years, I had lower back pain. just chronic lower back pain. And sometimes it got really bad. I couldn't even, I literally could not get my socks on in the morning. I'd have to use something like this to get my socks on. I could not bend over sitting on the floor or anything. It just hurt so bad. And one time I was in a Walmart or something, and I had something on a lower shelf that I wanted, and I forgot, and I bent over, and I literally fell on the floor. It was like somebody stabbed me in the back. It hurt so bad. But I kept reading about, back pain and what could cause it. And what was really weird is that the pain would go away completely for a few months, and then it would come back for a few months. And that went on for years. And I was trying to do exercises and stuff, and I thought there can't be anything physically wrong with my back if the pain goes away completely for months. So finally, 2003, I went to a back specialist. He was one of the top back surgeons in Cincinnati, Ohio. Cincinnati Orthopedic and Spine Institute. Where all the best back doctors work. So he, before I even got to see him, I had to meet with a PA, a physician's assistant, and he had ordered X-rays and sent me for an MRI. He said, "Doctor won't even look at you without an MRI." So I had to go get that done, and I went back again to actually see the back doctor. He came in, introduced himself, shook my hand, and put the MRI films on the viewer, and he said, "See that? You need surgery." I swear to God, the first words out of his mouth, "You need surgery." And he said, "See," he was pointing to the MRI, he said, see those discs, how thin they are? They're supposed to be way thicker than that. That's causing your problem. And he said, "I can correct that. I can fix it surgically." He said, I'll take the discs out, and I'll put wedges in there, and then I'll put titanium plates along, 3 or 4 of your vertebrae to just fuse them all together. And after that, you're never the same, because you lose all that flexibility in your back. And he said he would cut me open in the front to get to it. He goes through the front to get to my spine to do that. That would be a very invasive surgery. I'd be laid up for weeks, and the recovery would be months, and I'd never be the same. But he said, we can schedule the surgery now, or it's only going to get worse. He said, and you'll be back wanting to do the surgery. And so I didn't like the sound of any of that. And but I had read something. I actually read a whole book about, it's called Healing Back Pain or something. And this doctor said, who wrote this book, he said that most of the back pain that people have is not what your back doctor tells you. It's from abnormal muscle tension in your back. And sounds crazy, but this was real pain I had. And but he said that people have a lot of suppressed emotions, anxiety, and stress, and that causes tension in your back muscles. And it can affect your shoulders or other parts of your body as well, but it mostly happens in the back. And he said it causes real constant pain. And people don't realize that that's what's causing it. But he said if you realize that's what's causing it, and you address the problems that are causing that stress in your life, or he said just realizing that that's what's causing it will help the pain go away. And so anyway, that was when I had that diagnosis was in like February of 2003. that September of that year, I was laid off from my job. The company I worked for, they all in one day, they just fired half the company. They decided to outsource the work to India or something. And so I lost my job, and I hated that job. I'd always hated that job. It was when I was working in engineering, sitting at a desk doing the most tedious work that I hated. And so guess what happened? My back pain went away, never came back. After it was my job. I hated my job. That's what was causing my back pain. It's the only thing that made sense. And it was, oh no. In fact, that was in 2003. 2004, I climbed Mount McKinley, Denali in Alaska, the highest mountain in North America, with a 50-pound backpack on my back. 3 weeks on that mountain doing that. No back pain. Everything else I've done since then, I bicycled from Canada to Mexico. I still run marathons. I've climbed a bunch of other mountains. No back pain. Never came back. That guy was going to cut me open and do that to me based on a wrong diagnosis. And so I tell anybody who tells me they have back pain, I tell them that story. And I know that's not everybody's problem, but I believe there's a lot of unnecessary back surgeries that have been done. And that guy's still practicing in Cincinnati right now, cutting people open. Probably a lot of them don't need it. Anyway. I think stress. I think we don't pay enough attention to the effect of stress on our health. If you ever are in your job and you have a patient just has unexplainable symptoms, ask that patient, do you have a lot of stress in your life? Because that could be what it is, what's causing it. Okay. Sacrum, coccyx, we talked about that. And ribs. Okay, got to talk about ribs. Should we end class a little early today? Yeah. Sorry you guys have been sitting. I didn't get to do any real lab stuff, but next week we'll take some time for you. You can spend time with the skeletons yourself. But let's talk about ribs and then get out of here. So ribs. So the word costal means ribs. So if you see costal in a word, it has something to do with ribs. These are the costal cartilages. So this is all bone out here, the ribs, but these are the costal cartilages that attach the ribs to the sternum or the breastbone here. This cartilage is flexible. This is why you can do CPR. You can compress that on that sternum, and because of the flexible cartilage, how far do you push in CPR? Anybody know? But 2 inches. So they're that flexible, 2 inches to compress the heart. But anyway, these first 7 ribs are said to be true ribs because, well, that means that they have the costal cartilage goes from the ribs straight over to the sternum on the first 7. But the next 3, these, their cartilage doesn't really look like it so much, but like this cartilage comes up and attaches to the cartilage above it, and it attaches to the cartilage above that, and then that attaches to the sternum. So all 3 of these are to have their cartilages come together. So those are called the 5 lower ones are called false ribs, and that includes these 3, but also another 2 little ribs, short ones, that they don't attach to anything in front. They're only attached in back. So these are called the floating ribs here. Number 11 and number 12 ribs. They're the floating ribs. So 7 true ribs, 5 false ribs, and that includes the 2 floating ribs at the bottom. Okay. Is that enough? Okay. So I'm going to just stop here. If you want to hang around and look at bones, start learning them, you can. I'll be here. Lab will be open. Or if anybody wants to play with that thing, you're welcome. The anatomage, it's there. Maybe we should use that next week for studying bones. I don't know, that'd be cool. We can, this is not a human, but we can just choose the skeletal system, just bones, and you can select which bones you want. If you want to remove the spine, remove the ribs, remove the pelvis. So you can just look at, so it's just got the teeth by itself. So this will be here. I'll have it on. It's on now if you want to play with it, but I'll have it on next week, and I'll just have that on every week from now on. And we can use it as we want to help learn some of this anatomy. Okay. But otherwise, you're on your own. So start trying to learn these best you can. And just leave your phones anywhere. I'll pick them up. I'll put them away. Bye.
Why they that.
That's cool, isn't it?